Hello and welcome back to Medical Compliance with Clarissa. My name is Clarissa Benfield. I'm our Global Director and Business Line Leader for our medical and laboratory business here at Intertek. And today I am so thrilled to be joined by Phil Kingham. Phil, thanks for joining us.
Thanks very much, Clarissa.
Yeah, absolutely. So Phil, you come to us from an exciting acquisition that we had a couple of years ago, really focused in the standards management space. So maybe you can give us just a brief introduction to yourself, how you got into the standards side of the organization, and then we'll dive into some really interesting questions specific to standards and standards management.
Yeah, absolutely. Thanks, Clarissa. So I've been with Intertek Inform, the Intertek Standards and Regulatory Management business unit for coming up to 10 years this year. My background has always been in information management, software development, but I guess over the last decade or more, very much focused on enterprise content management, whether that's helping large organizations structure, secure, and access large quantities of their own information, or more recently with Intertek Inform, helping a range of business sectors access the regulatory and standards information they need to take their products to market.
Yeah, and I think this is such a critical area. And, we were chatting about this right before we got started, right? This idea of standards. And, sometimes we have manufacturers that maybe haven't considered the standards yet or coming late into the game looking for a standard when developing a product. Typically on the medical side, right, we do see that manufacturers understand there are standards. We have 60601 601 and the whole umbrella of standards underneath that. They understand that they need to be designing with those standards in mind, right? Thinking about those standards as they're putting the products together. But of course, it's incredibly important for the whole regulatory process to be not only using those standards, but up to date on the standards and regulations. So you mentioned this Intertek Inform. So maybe you can give us just a little bit of information about how that works, right? It can be super overwhelming from a regulatory perspective to track standards. So I know with Intertek Inform, we have some interesting kind of solutions out there.
Yeah, so if I start in the sort of the basis, you're absolutely right. It's an incredibly dynamic environment, not just the development of new standards. We talk a lot about what's happening in the world of AI, particularly in medical devices. And again, ISO have just released a major new standard in January, December for AI management systems. So huge transformation in that game as well. But the constantly evolving regulatory landscape, particularly in Europe, but elsewhere too, compelling organizations either at a regulatory or compliance perspective, to make sure that they have those standards, that they're considering those standards all the way through their product life cycle. At Intertek Inform, we've got a little over 1.6 million standards on our database, from 360 global publishers. So, it is really difficult for organizations without a management system to be able to find the standard that they need and to be able to, I guess, importantly, be alerted to when that standard changes, when new versions are updated and released. So that's part of what the service that we offer. But I think at the heart of your question is, organizations, whether it's large scale multinationals or launching new products, or small organizations at that kind of R&D stage, the question we're often asked is, what standards do I need? And it is a really difficult starting point. I guess fortunately in our platform, first of all, we've got the expertise within Intertek, across the business to be able to provide that guidance and consultancy and advisory service. But specifically on the platform, we have a very sophisticated search capability that allows organizations to search for specific standards or search for specific sectors of standards. So within the medical device industry, you'll be able to find out standards related specifically to the classes of the sectors that they operate in.
Yeah, and I think, you mentioned this, right? So 360 different standards publishing bodies, right? I think, people are very familiar with some of the major standard publishing organizations, right, that we see really frequently over and over again, but they're not inclusive of everyone that's out there or all of the standards that might apply, especially when you start getting into some of the more niche geographies or demographics where people are trying to ship their products and make sure that they're, conforming with a local standard requirement or a local regulatory requirement. Specifically on the medical side, right? We focus a lot on this podcast on medical and laboratory equipment, right? So how do you help manufacturers in a specific industry, right, to obtain the right standards when they need them, make sure that they can keep up to date on the changes or the upcoming, regulations or standard changes? How does that actually work in practice?
So in practice, the content, the standards are all hosted in the cloud. But I guess, when you look at a standard, the actual delivery of a standard hasn't changed that much since we were buying PDFs and hard copies. It's still delivered via a web browser. I think we're on the cusp of some big transformation in information management within standards, where standards will be delivered as content. Perhaps we can talk about that a little bit later on.
Yeah.
But I guess really what we provide is this very flexible tool, a product that we branded I2I, it's information to intelligence, that gives a very simple to use, very accurate ability for users to find those right standards. So, we'll work with our customers to make sure that at the beginning of their subscription, they have the standards that we know that they will need, and we provide them with the flexibility to add additional standards, either as their business matures or the product portfolio expands. But as you know, within medical devices, it's not just about accessing the standards, it's about linking that standard to the product or the process that is deployed within the organization. And that's something unique that we do at Intertek Inform, is we create those relationships between the standards and the cross-references through to an organization's particular product, in their technical files. And when we talk about alerts and notifications, in most industries, telling you that a standard has changed is a catalyst for a review process. But when you look in the medical devices, it's going to trigger a whole series of other workflows. And that's a very important dimension that we offer within that market, the ability to tell you that standard X, which is cross-referenced in product Y in these markets, has changed. And now your whole kind of technical file will start to move through that organization as a controlled workflow.
Yeah, I think that's so critical too, because right, when we think about medical devices, you have the standards, which is one layer. You also have the regulatory agencies, right, where you have to comply with their requirements, utilizing those standards. And then with the, multi-dimensional products that manufacturers have, sometimes with, different types of standards that are involved, it becomes really nuanced, right, and layered to try to keep track of everything that is required and where it's required and when it's required, especially when you see some of the Part 2 standards, which are kind of the additional medical standards that are then updated, and being informed and aware of that makes such a huge difference as part of someone's regulatory planning process. And I think too, we talk about this a lot, but looking at regulatory affairs personnel or quality affairs or people who are working in that segment, a huge part of their job is managing the risk, right? Making sure that you're not going to be out of compliance from a regulatory side or from, a actual standard side. So are there ways, on an ongoing basis that we're able to help, specifically looking at managing the risk?
Yeah, well, so part of what we do at the moment, actually, one of our MedDev customers refers to that as the three-dimensional matrix, trying to put together all of those pieces, around the standards, regulatory, and the relationship to their product. And yeah, absolutely. So within our platform, we provide our customers with, it's a fairly simple workflow, but it's really, again, linking the standard to the product, and then to specific roles within the organization, whether that's reg affairs, QA, or engineering, so that the right people are notified in the right sequence of changes in standards. And we're actually extending that, because I think when you think of standards and standards changes, we often think of a new version being published, which is kind of a lag event, right? It's happened, that's great. But what increasingly our customers want to know within medical devices is what standards are going to change in the future. And how can I be made aware of that? And, in some cases, how can I influence the design and the direction that standard takes? So that's another part of what we do within our technology solution is provide this horizon scan to notify clients of impending technical committees being formed and draft standards being developed. So, yeah, it's constantly changing. And those regulatory and compliance risks come from everywhere, right? It keeps it exciting, yeah.
Well, and I think too that obviously also provide a key value for a manufacturer to know that a standard, maybe a particular standard or Part 2, is going to have a new edition or a new version if they want to participate in those standard committees or vie for a position on those standard committees as well, right? To know something is upcoming a year from now, 2 years from now on the horizon, right? These things don't happen overnight. So that provides additional value as well, right? To make sure that okay, we need to be actively keeping our eye on this standard or getting engaged in the standard committee because we know that that's going to impact our product design or the future of our products.
Yeah, 100%, 100%. And the extension from that with the horizon scanning is not just the input and the direction of standard, but the preparation for that when it does get published and released. That a lot of our customers and our strapline is faster to market. This information, giving people that early warning, that alert to the possibility of a change in the standard, really allows them to prepare for that in a timely fashion, so that they're able to deliver their products safely to market.
Yeah, and I think, one thing that we can't discount too, right? I mean, we've seen this as a global trend throughout all of the medical device manufacturers that we're working with. Is just this movement in the market of staff and personnel and technical resources. Yeah. So when you have a lot of tribal knowledge or industry knowledge that people have, and then they leave companies, right? People left throughout the pandemic, left the industry, didn't come back, moved to other companies. And so now we have, in some cases, new generations of people sitting in the quality affairs side, sitting in regulatory, sitting in compliance, that don't have, a long background history or knowledge of all of the standards. So having a platform in an area that they can turn to really understand, okay, here's all the standards, here's what's coming up on the horizon from an efficiency standpoint, right? For some of these people, it can make a really significant difference. And again, with the goal of, getting safer products to market faster, using the right standards and being aware of what's to come.
Yeah, absolutely. When we look at that with our client base, we look at our clients, across the spectrum in terms of the scale, but really on an information management maturity sort of model. And those that are most mature really are dealing with that risk of loss of corporate memory. And in our space around standards, regulation, and compliance, they're building into the platform that broader context. So rather than it just be a list of 360 publishers or millions of standards, they're creating an organization taxonomy structure where they can associate both the standard with the technical file, with their own internal SOPs, so that a new hire can actually just get into work and it's content that they can use in a knowledge sort of manner. So yeah, no, absolutely, critical impact on the sector at the moment.
Yeah, absolutely. Well, one area that I'm super excited about, we've had lots of discussions about it on this podcast, is looking at AI, right? And how AI is changing our lives as consumers, right? Everything that we're doing day to day. Also, you mentioned it earlier, right? The impacts that it's having already on the medical industry. We know, people have been employing AI in med devices for some time, and now it's just rapidly advancing. So are there ways that, AI is being utilized or making things easier, better, things that you're seeing from your side on the standards management side?
Yeah, absolutely. I have to be a little careful because we're about to launch some new versions of products. So I can't talk too much about it, but I'll talk in the general sense. Yeah, earlier on I was talking about obviously new standards. So the ISO 42001, which is the new management system for AI. That's going to be a game changer for anybody involved in the design, development, deployment of AI, and bringing in, I guess, that ethical consideration, transparency into an organization's risk assessment of AI. But specifically, when I look at AI within the world of standards management and delivery of standards, and we can relate this directly back to medical device, it's really about providing context to standards. So one of the use cases I'll talk about at the moment, a big efficiency driver that we have in our platform for our clients is the ability to compare two versions of a standard. So standard X, has been replaced by standard Y. How do I know what's changed within the standard? And a lot of these documents can be hundreds of pages. And if we're paying engineers or reg affairs, people's salaries, they will spend, I think the average is something like 72 hours to review an ISO standard. So huge cost associated with that. So we've automated that. We provide an online markup and comparison tool, which has really sort of eliminated a lot of the heavy lifting, and now people can take I guess a more impactful role in terms of assessing actually what do these changes mean. Great, here's change. How does that impact my business, my process, my product? When it comes to AI, I think this is where we're starting to see the really exciting benefits of it. Is yes, we'll give you the comparison between A and B, but we'll also be able to give you the context of what does the standard change look like. What is the difference at a summary level between standard X and standards Y? what is the detail and the impact? That's probably the most important thing.
Mm-hmm.
People want to know, what the tolerance or thresholds are, but when they change, they want to know what the impact is to my business. Am I going to have to invest in new capital? And I have to recalibrate, part of my manufacturing process. So that's where we see AI in the short term really adding value to the medical device sector, and other engineers, reg affairs professionals, is providing that insight and guidance. And then beyond that, which I can't talk about, it's getting really quite exciting. It's some phenomenal innovation coming through. And I think for us in the general information management sector, it's probably been it's a revolutionary change, right? It's as big as the agricultural industrial revolution. Information is just going to be consumed and used in ways that we haven't even thought about. Let's be honest. It's such an exciting pivotal time.
Yeah, I couldn't agree more. And that's just an amazing time for the med industry. And when you talk about like ways that there are efficiencies that will be found in, comparing two standards that may have taken, and I think 72 hours might even be light when you're talking about medical
that's the average.
to be honest,
big ones out there.
When you're looking at it, trying to really understand the key differences, and that could change your design, as you say. I mean, it could take time to implement design changes, but having this from an efficiency standpoint and being able to utilize AI is just amazing. And, on the med side, we've been talking about it a lot, just in terms of all of the ways that AI is incorporated into the medical devices system, the healthcare system, ways to just improve, overall patient care, ways to improve, device development. So I think, over the next 12 months, right, we're going to see so much more development in the standard space. You mentioned the 42001, of course, which is the AI management standard, but we're going to see a lot more standards coming out, a lot more guidances from FDA, IMDRF, all of these regulatory agencies really pushing people towards AI, guidance on what they can do with their medical devices. So
and obviously under MDR and the recent AI Act in Europe, there'll be a whole suite of new AI related harmonized standards coming out. Some are in draft, some are just at the very early stages of technical committee. So dynamic environment. Watch this space.
Yes, harmonized standards always our favorite, right? Better than all of the different publications. Yeah, absolutely. Well, before we end here, Phil, is there anything else that you want to add just about standards management, or anything else that you, as a key takeaway for the audience, or anything you'd like to share before we close?
Well, I guess I think that the themes that we've discussed tonight, that how daunting standards can be, and approaching that, obviously for organizations that have been working in this environment for a while, it's about managing change and the risk associated change. But, I think for organizations, particularly in med dev, where we've got a long tail of SMEs, people who are moving out of, into innovation and startups, I think, talk to you, Clarissa. You can make contact with us. We have, scalable solutions for you, but we also have, the ability to give you that guidance around, what that right first step will be. Don't be daunted by it. We're the people here to help. Yeah,
it doesn't have to be as scary as it might seem. So, Of course, anyone can reach out to me directly at any time. We can connect you with Bill and the team. But really great to have this conversation. Appreciate your time today. And again, if anyone has questions, feel free to reach out. Thanks so much.
Thanks so much.